This segment of Delmarva Life is brought to you by TidalHealth.
You know, over the past, well, gosh, I guess it's been a year and a half now, you have probably heard that phrase that all superheroes don't wear capes. And we couldn't agree more.
And today we're focusing on the superheroes who wear scrubs. And we're here with one of them, Stan the Scrubs. We'd like to introduce you to TidalHealth's Director of Community Health Initiatives, Kat Rogers. Thank you so much for being here this afternoon.
Thank you. Thanks for having me.
So we understand that you have been instrumental in protecting our community by setting up these COVID vaccine clinics and getting health care to the people. What drives you to do this?
Oh gosh, population health has been my passion for many years. I have a master's in public health. I was brought up by Worcester County Health Department. I spent about 9 years there, and then I bring that background with me to TidalHealth. So actually, I wasn't going to talk about this, but my first job at Worcester Health Department was the H1N1 clinics.
Oh.
And it was like training wheels. And when the COVID pandemic happened, I had studied it. You know, I had the practice. I had written emergency plans for the health department. And so I was excited to be able to contribute in some way, because I'm not clinical, I'm not a nurse actually.
Right.
And so to be able to be a part of something so great that could save so many lives and make such a difference has just been my dream.
That's awesome. I'm sure that's one small part. What do you do? What are your responsibilities with TidalHealth?
So I probably have the coolest job at TidalHealth. I'm Director of Community Health Initiatives, and I manage a mobile wellness team that's boots on the ground. It's led by a nurse practitioner, has a social worker, community health workers, and a registered nurse. And they canvass the region of Delmarva. They go into churches and homeless shelters. They go into the homes of individuals and really connect the dots and meet people where they are to keep them healthy and out of the hospital.
And that's important. I guess the health of the community is important to the team at TidalHealth.
Oh yes, and TidalHealth takes a unique approach to population health. They truly believe in addressing the social determinants of health, so trying to address issues with transportation, housing, home repairs, food insecurity, and tackling those social and economic factors that can have such an impact on someone's health status. So that's what our department does. We're out there addressing social determinants of health.
And another thing that your department does is the drive-through flu clinics, right?
That's right.
Have they changed this year?
They're getting bigger and better. This is the 27th year of the drive-through flu clinic at Purdue Stadium in Salisbury. Wow. So that's a very exciting milestone. But this year we're doing something different because we're a part of TidalHealth in Anacoke, and we've partnered with Del Tech. So we'll be at Georgetown this Saturday from 8 to noon. And we're hoping for a great turnout and a very smooth event. And then this will be the second year that we're at the TidalHealth McCready Pavilion in Crisfield.
Do I make an appointment? What do I do?
It's so easy, and I want to recommend everybody get their flu shot this way because you can avoid crowded pharmacies. All you have to do is drive up. There'll be plenty of staff and signs to direct you where to go. Make sure you wear like a short sleeve shirt or something loose so we can access your arm for your shot. And it's free. It's for anyone who's age 13 and up. Of course, if you're a minor, then you have to have a parent with you to sign that consent.
Yeah. So I guess we've talked before about flu numbers being down because everybody was wearing a mask during the COVID season. So how important do you think it is this year to get your flu shot?
It's important every year to get your flu shot. It's recommended for people 6 months and older. But last year we saw record low numbers of flu because of all those pandemic precautions, masking, remote work, remote school, social distancing. And despite the pandemic continue to rage on in our communities, a lot of those pandemic precautions have fallen by the wayside. So people are going to be more exposed. Yeah. They are gathering. People are back in school and back in work. And so we want to protect our community and protect the health system from getting overwhelmed. The flu is a very dangerous virus. It comes around every year. And year after year, the evidence shows that the flu shot's effective in preventing it and in having a lesser severe case of the flu.
Yeah, absolutely. Okay, I think we should note though, this is just the flu vaccine. You're not giving COVID vaccines at this site. So can we still get the COVID vaccine?
That's right. So we won't be doing COVID testing or COVID vaccine. It's just a in and out flu shot event, but it's important to get your COVID vaccine, and the best sources for that are the local pharmacies and the local health departments. So call any of them. They all have walk-in appointments available. They usually have all 3 vaccine choices. So that's the best route for your COVID vaccine.
All right, so it's at Nanticoke this Saturday, and then the following Saturday?
Del Tech.
Del Tech.
Yep.
Nanticoke.
Nanticoke is at Del Tech.
Nanticoke is at Del Tech.
Yep, and then next Friday at the Purdue Stadium, and then October 16th, it will be in Chrisfield.
And of course, we'll have that information on our website, delmarvalife.com. TidalHealth's Kat Rogers, thank you so much.
Thank you.
And thank you for all you do for our community.
Yeah.